Stem Cell Therapy for Rheumatoid Arthritis by Claire Palumbo. Stem cells, or blank cells, are naturally unspecified. They have the ability to develop into different cell types in the body during early life and growth, or as a part of a regenerative process. They can repair, rebuild, and rejuvenate the body. Stem cells are special in two different ways. One, through their ability to renew through cell division, and two, they can be induced to become tissue or organ specific. These properties and discoveries have led stem cell research to becoming a frontrunner in the world of science and medicine and discovering new possibilities of treating the sick. Adult stem cells, or somatic stem cells, can be found all over the body in places such as the brain, bone marrow, blood vessels, skeletal muscles, skin, teeth, the heart, and many more places. Some of the most interesting and promising stem cell research is cell-based regenerative therapies. Cell-based regenerative therapies using stem cells have had some contributions and effects on the mission to cure and help those suffering with rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disorder affecting many joints, including those in the hands, feet, knees, arms, and other places. It affects over 1.5 million Americans. However, it is most common in the elderly and in women. It is the most common type of autoimmune arthritis where the body's defense system fails to work properly. The immune system attacks its own tissues by mistake. There is a lot of hope about what stem cell research could do for rheumatoid arthritis. This excitement was furthered when the Arthritis Foundation partnered with Celltex.
Cell. So I'm here to talk mostly about rheumatoid arthritis. So what is the basic problem with rheumatoid arthritis? The basic problem is there's nothing wrong with your joints, there's something wrong with your immune system. And your immune system is attacking your joints, okay? And so the solution would be induction of tolerance or getting your immune system to back off a little bit. So this is what happens when you're stimulating the T cells. The problem with rheumatoid arthritis, as well as multiple sclerosis and similar autoimmune diseases, is that you have these T cells that you have a naive cell, and then it becomes activated, and then it starts creating an army of cells. And this army of cells, they're called T cell clones that attack the joint in the case of rheumatoid arthritis. And where MSCs block this is right at the top, and I don't have a pointer, but if just after the activation, then when they start dividing, it blocks this process right at that point.
Mesenchymal stem cells are the stem cells used in cell-based regenerative therapies used to treat people with rheumatoid arthritis. Now we're going to talk a little bit about how those work. This is actually a mesenchymal stem cell, and the reason why they're so widely used is because they actually have a lot of tissue healing properties within the cell. Another thing about mesenchymal cells is that they have the ability to duplicate themselves and differentiate into many different types of cells, such as muscle cells and other cells that the body needs to function properly, which is why they are used in cell-based regenerative therapies. Mesenchymal cells actually live right on top of blood vessels. Over here we see a representation of an injury actually at the top of a blood vessel. And as you can tell, the mesenchymal cell will go to the injury site and duplicate itself, and also it can create other types of cells that this area might need in order to repair the area. As you can see, mesenchymal stem cells have the ability to turn into many different types of cells, and furthermore, they can make sure these other cells function properly within the body to heal different types of injuries, which is why they are used so widely throughout the body, specifically in rheumatoid arthritis, in order to heal different kinds of joints and other problems in cartilage areas. There actually have been a lot of different research studies and clinical studies done investigating MSCs in condition in comparison to people with arthritis, and also with mice induced with types of arthritis. Here is one research study where scientists studied how mesenchymal stem cells could prevent tissue damage in collagen-induced arthritis. Mice were studied in this research study and given the proper conditions, and the result ended up showing a single injection of mesenchymal stem cells prevented severe damage to bone and cartilage. This promotes the use of the science, as do many experiments with mice. However, when the results were transitioned into clinical studies, they have proven slightly different, as they are slightly less effective in some individuals. Although this has not been exactly determined why, there are a lot of people concluding that there are certain conditions that still need to be studied. Now we're going to look at one of the leaders on mesenchymal stem cell research in humans. There are a lot of companies using MSCs and cell-based regenerative therapies to cure patients with rheumatoid arthritis. One of these is actually Celltex, a Houston-based biotechnology company specializing in banking one's own stem cells for therapeutic use. These MSCs that are banked have been shown and studied to have amazing healing properties, whether they are your own or someone else's. Celltex works with people who have rheumatoid arthritis to use their own regenerative cells to heal their bodies. Celltex combats rheumatoid arthritis using these MSCs. Their clinical studies have proven effective in reducing pain, suppressing immune response, reducing inflammation, and contributing to cartilage regeneration. However, this is even better because it is done without severe adverse effects. They are completing more studies to determine how to maximize the benefits and appropriate dosing regimen to guarantee results. Now we are going to look at how MSCs and cell-based regenerative therapies have become such a huge business and how these business practices are done.
This is his business plan. He takes a huge aspirate from somebody, usually a male, between the ages of 20 and 30 years of age. He, in the technology that was generously transferred by Case Western Reserve University, he uses our patented process for isolating the MSCs, and he expands them in culture using a selected batch of fetal calf serum, and he gets 5,000 to 10,000 doses. And here's his current clinical trial for MSCs. The worldwide rights were purchased.
There are many more studies and research being done on how to reverse adverse effects of rheumatoid arthritis through stem cell research. In a statement by the National Institutes of Health, they said research on stem cells is now providing new approaches to strategically remove the misguided immune cells and restore normal immune cells to the body. However, despite compelling evidence, the FDA has not approved stem cell treatments, and they are covered by few to no health insurance policies. The FDA is currently investigating MSCs used for rheumatoid arthritis, but they haven't been approved. There is a reason for this, though. But first, let's hear about how MSCs actually work.
Umbilical cord MSCs and multiple sclerosis rheumatoid arthritis. Again, these cells modulate the immune system. They increase the number of T regulatory cells, so they block clonal expansion of activated T cells, which is another problem. I have a cartoon on that. And MSCs from patients with autoimmune diseases do not work properly in the majority of cases. So when we do we take fat and we grow those MSCs up, or we take bone marrow and we grow those MSCs up, they're not nearly as robust as cells taken from healthy people.
The reason that the FDA has not approved these treatments is that despite Celltex claims that up to 50% of patients still fail to achieve a significant clinical response, according to Stem Cell Institute. However, there are still no negative side effects to trying this regenerative theory other than the usual absorbent cost, sometimes over $100,000, although these high costs are dropping in recent years. There is a claim that the body will attack these cells, but this doesn't prove to be a problem. The body's immune system is unable to recognize MSCs, which are usually umbilical cord derived, as foreign, so MSCs are not attacked by the immune system. At the Stem Cell Institute, out of the thousands of these injections, there has never been a single instance of rejection of the MSC cells. According to StemGenX, there are 3 processes that could work for rheumatoid arthritis treatment using cell-based regenerative therapies. Firstly, patients can be given intranasal administration through the vascular pathway of the nose. Second, patients could be given MSCs through IV, intravenously administered through the vein over a course of a few days. And third, patients could also be injected through a direct method, where the site that needs repair receives the MSCs immediately. The procedure is considered minimally invasive and there is a little recovery and downtime, according to Dr. Maria Dolan, interviewed by MD Links. A lot of companies are still conducting clinical trials to discover if MSCs will be effective in treating people with rheumatoid arthritis. Here is one of the protocols that a company uses to see whether these MSCs can be effective in patients and their survey results.
So we're actively recruiting. We have 20 patients in this trial. It's essentially 1 week in Panama. We do a 3, 6, 12-month follow-up, and the protocol for rheumatoid arthritis is very similar to that. So here are some data just from patient surveys because the prospective trial data are not available, so we only have patient survey data. And like Dr. Paz says, not everybody gets better. Not everybody gets better the first time. Some people it takes 2 or 3 times for them to see improvement, but this is taking a single treatment and a cohort of patients and looking at all these different factors and then looking at them at 120 days. And you can see that 33% of the people had no benefit, 20% had a significant benefit, 32% moderate, and 15% had a slight benefit. And this is the 1-year data. 39% had no benefit. This is after that period, so some of them lost some of the benefit. 8% had a slight, 36% moderate, and 17% significant improvement.
According to this study, there were significant results, but there are a lot of clinical studies and research studies still being conducted on the effects of mesenchymal stem cells on patients with rheumatoid arthritis. A lot of research still needs to be conducted, so I believe that there is more opportunities for this type of science to grow and do interesting things for people with these conditions and possibly help people live better lives. Overall, I hope you guys learned something today about mesenchymal stem cells and their effect on rheumatoid arthritis as a type of therapy. Thank you for listening, and I hope you guys have a great rest of your day.